Today I'm super excited to talk with you about a heart-healthy diet. So let me start off by telling you what I generally eat. For breakfast, I generally have a cup of hot black tea. Banana is one of the most heart-healthy foods. Some of you may know potassium helps lowering the blood pressure. For lunch, I generally have some salad, and that is usually loaded with lots of leafy green vegetables. In addition, I will have usually a protein. Usually, because it gets pretty chilly in my office, I always like to have a small cup of soup. For dinner, some days it could be Mexican, like guacamole with tacos. Other days it might be Indian vegetarian dishes, and sometimes the fish. Now, the main advantages of eating fatty fish or oily fish is that they have a very high concentration of omega-3 fatty acids, the good kind, and omega-3 fatty acids have a lot of beneficial properties in terms of reducing our risk of heart disease. As far as heart-healthy diets go, the two main diets endorsed by the American Heart Association are the Mediterranean and the DASH diets. I will start with the DASH diet. The acronym DASH stands for Dietary Approaches to Stop High Blood Pressure. And we have shown that in the DASH diet, by reducing the amount of sodium that we consume, as well as increasing the amounts of calcium, magnesium, as well as potassium, we can greatly reduce our levels of blood pressure. The main ingredients of a DASH diet would be lots of whole grains, fruits and vegetables, and low-fat dairy. As we know, the fruits and vegetables are high in potassium. The low-fat dairy gives you the calcium. In addition, eating fish, poultry, at least a couple of days a week. Now, talking about the Mediterranean diet. So, we saw that in Mediterranean countries, even though they do not necessarily consume a diet that is very low in fat, people live longer and are relatively healthier. So the Mediterranean diet mainly includes a plant-based diet, lots of whole grains, fruits and vegetables. Instead of using saturated fats such as butter or margarine, it is better to switch to canola oil or to olive oil. These diets have been shown to increase life expectancy and not only decrease the risk of dying from heart disease, but also decreases the risk of dying from other causes. And now I would like to introduce to you Erin Mann. Erin is a registered dietitian here at Memorial. Hi, how are you, Erin?
I'm good, Dr. Bhadha. How are you?
Wonderful, thank you. Can you tell us what you would recommend to our patients who ask you about heart-healthy food?
Absolutely. Really, I say the same things that you were saying. Starting the day with some really good sources of carbohydrates is a great way to start. You have the whole grains, which is going to give you a lot of fiber and energy to start your day. Indulging in the butter is exactly what I would tell my patients. Pick a time of the day, a meal or a snack that you want to indulge a little bit and enjoy it.
So what about if you get very hungry in the middle of the day? What snacks can you eat?
Snacks are a very important part of the day for me, and it just depends. If you can bring some snacks from home, you can really make it customizable. Some of the snacks I usually recommend is a low-fat string cheese with some grapes to get that protein, the fiber, and the fruit together, kind of that sweet and salty mix. You can also do other fruits, apples, bananas, things that travel really well. A lot of the foods now come in those travel packages like peanut butter, guacamole, hummus.
I think the important thing is to ease into these diets gradually for someone who is not used to eating these type of healthy diets.
Think about what you can add versus what you have to subtract. So what vegetables can you add per meal? What fruits can you add is so important, and that's the most effective way to make these changes and to be able to adhere to a DASH or Mediterranean diet.
Thank you for being here, Erin.
Thank you so much for having me.